Hi, everyone. Good afternoon. Thanks so much for being here. My name is Rebecca Rear. I'm the Director of Climate Policy and Justice at the Maryland League of Conservation Voters, and I'm excited to welcome you today to talk about water, climate change, and your health for the next hour or so. So thanks for spending your lunch with us. Grab some water, grab a brown bag, and hang out with us for an hour to talk about climate change, water, and you. So I'm with the Maryland League of Conservation Voters, and and it's an exciting day, of course, after the primaries for us, but as we focused on getting out the vote. But we are sort of fondly, I'll say, known as the political voice for the environment, and our vision is a healthy environment for everyone. And part of the work that we do is recognizing the way that climate change is impacting our health and the health of all Maryland residents. And so one of the initiatives that we co-host with the Maryland Public Health Association is Maryland Health Professionals for a Healthy Climate. And we're still a relatively new group, only about 2 years old, and still growing our membership. So we'll definitely have more information for you if you're a health professional in Maryland and want to get engaged in climate action. But we are really excited to co-host with a couple other organizations today this webinar so that you can learn all about the way that climate change is impacting water all around us, and how that impacts us and our health. And, you know, if you stay tuned for the whole time, maybe what you can do about it also. Yeah, we're really excited and hope that you learn a little bit more about our organization or our group and the way that you can get involved. And I'm excited to spend the next hour with you talking about these issues. And I'm going to hand it over to my colleague at the Maryland Public Health Association, Melanie Bolden, to say hello and welcome you from the Maryland Public Health Association.
Thanks, Rebecca, and welcome everyone. Yes, I'm Melanie, and I'm the Climate and Health Coordinator with the Maryland Public Health Association. And just a little bit about the Maryland Public Health Association. It is an affiliate of the American Public Health Association. It's actually one of the oldest and most vibrant state affiliates of American Public Health Association. And it's Maryland's leading professional organization for those working in the field of public health. MBPHA remains dedicated to increasing health equity for Marylanders through advocacy and community collaborations. We host events throughout the year to promote education, awareness, and advocacy of critical public health issues affecting Marylanders. And of course, we're happy to support this event and co-host as well. And with that, I want to pass it off to another co-host. We're co-hosting this event with the Potomac Riverkeeper Network. And with that, I'll pass it over to Ms. Betsy Nicholas.
Thank you, Melanie. My name is Betsy Nicholas. I'm the Vice President Programs for Potomac Riverkeeper Network, and we protect the Potomac and Shenandoah watersheds, which is actually kind of a rather massive area of water throughout Maryland, Virginia, West Virginia, Pennsylvania, and DC. So a lot of area to protect, and more than 6 million people in this area are dependent on the Potomac for their drinking water. So it's really important for public health as well. So what climate change is doing to this watershed, changing the characteristics and exacerbating some of the public health impacts of toxic chemicals and historic pollution in this watershed is of great concern for us, and is part of the reason that we've been working with our main presenter. Dr. Natalie Exum is not only a friend and a colleague, but quite an impressive specialist in environmental health, microbiology, and many other things. But she is able to talk about these things and actually can understand her. So that makes her particularly good to work with on these various topics. So I'm going to hand it over to her now and get this party started. So Natalie.
Thank you, Betsy, and everyone. Thanks for joining during your lunch hour. I know these hours are precious, and so I hope that what this can be both informative and uplifting, if we can say that, about climate change and these uncertain future scenarios that are before us and that are happening all around us. So thanks for that introduction. I'm going to get a little academic on you just to begin. We're going to talk about this idea of an F diagram and how water is kind of this connector of just this F diagram. It's a concept in our field. of environmental health and microbiology. But then we're going to talk about climate change and water supplies in general, excess precipitation and flooding, just because here in Maryland, all the climate models agree that that's our new reality, how that's related to waterborne disease risks. And then we're going to talk about some nature-based solutions. And we're going to talk, I want us to end on solutions and adaptations and what we can do, because there are things, and this is not just going to happen to us, but we have to think through what our new future is going to look like. So I won't get too academic for very long, but this is the fecal oral pathogen transmission F diagram. And this is just to map out, this has been around forever in the field, that we have all these different pathways, how we move from having fecal feces, from defecating in our toilets, all the way to what happens when we're vomiting in our toilets. Sorry that I'm talking about this during lunchtime. I'm usually I usually ruin it for everybody. But long story short is that our sanitation systems and our toilets are a main barrier to really keeping us healthy in our everyday lives. And there was a time when feces and sewers would be open and be flowing in our streets, and there was a lot more typhoid and cholera in the United States, believe it or not. It was almost, just 100 years ago where that was happening. But all this infrastructure really keeps us safe. A safe water barrier. Our drinking water treatment plants do an amazing job of ensuring that many of the pathogens, almost all of them that are getting us sick, are taken out at that kind of system-wide level. And the hygiene barriers, hand washing, having proper hygiene barriers to ensure that our food is also not getting us sick. So that's a conceptual model that was redesigned by the World Health Organization not too long ago. And this is really where, we're going to get into a lot of different dimensions of this today. But long story short is that it's not just your toilet. Are the feces managed after you flush them? Are they safely contained? Are they safely conveyed? Are they treated properly at the wastewater treatment plant? Are they in a combined sewer? There's lots of ways that all these hazardous pathogens and contaminants can not be treated properly, or have certain environmental big storms that really disrupt this infrastructure and cause adverse disease outcomes. So let's get started on the gloom and doom. And these are not things that I think most people have heard of them by now, but with climate change, we are headed for just a more extreme future. So when there are droughts, we're expected that those droughts may last longer. This, is well exemplified by the American Southwest, and how the Colorado River barely flows to its end now because there have been so many long-standing droughts and withdrawals that are going on there. So water source availability changes. Also, this flooding and we're going to talk a lot about this today, and how it can really mobilize potentially, kind of legacy contamination, or it will wash out certain septic areas or wastewater treatment plants and cause lots of contamination. Heat waves and higher temperatures, they can have many effects, but one is that they can change the temperature even of the surface water. And so, for the first time this year in the United States, we saw Vibrio vulnificus infections happening all the way up in New York and close to the kind of Connecticut, Rhode Island border, right? So very, very different. Just the temperature of the water changing also changes the risks that we incur when we enter into recreational waters, say. The over extraction of groundwater supplies. So a lot of our drinking water systems, or a lot of the water systems we depend on, are taking water out of the ground. It's actually kind of a nice natural, when water flows to the ground, there's this kind of slow sands sediment, filtration that occurs. So groundwater is actually a great water source because it's a lot cleaner than, say, surface waters. But the over extraction of that causes soils to collapse and subsidence. And then compounded that with sea level rise. We know that our Arctic areas and our those kind of big ice caps that have been there for ages are melting at rates that are causing rising seas, and then that results in a lot of more coastal flooding. So there's riverine flooding, which we'll talk about today, but there's also coastal flooding. We have a lot of those coasts here in the Maryland region. So just a moment to talk about subsidence. What is that? It sounds like an abstract thing that's happening. It's actually not. It's happening in a lot of our backyards. When you have all these different layers of dirt and soil, a lot of the water is stored inside of these soils. And so when you over extract water out of the ground, the soils will collapse. And it does two things. One, that means you can't replenish the groundwater because that storage is now gone. It also means that you're going to have the ground is going to fall down, like collapse. And so this is actually a link that was taken out of a really nice piece from the New York Times done in Mexico City, which is over volcanic soil. So this is not obviously relevant to the Maryland region, but those volcanic soils are particularly fragile. And if you go to Mexico City, you can see the buildings are really in bad shape because of it. But to bring it more local, this is actually also happening on the East Coast. And again, the New York Times has done some of the best, in my opinion, investigative water reporting in the past few years. And this was a recent piece that came out to show that the dangers from subsidence and rising seas means that we're going to have a lot more coastal flooding than we did before. And so some areas are actually rising just due to these shifts, but most of the ones that you're seeing here in red are sinking. And then actually in Hampton Roads, Virginia, they're injecting treated wastewater into the ground to prevent the subsidence from happening. So this is a very real thing. And you can check out that story if you're interested. This is a photo from the Inner Harbor in Baltimore on a normal high tide day, right? The sun is shining, there's no rain, extreme flooding going on from precipitation, but this is just the reality of what our coasts are going to look like. And, what adaptation is going to look like for this specific area, it's going to be a big challenge. We need lots of architects and urban planners thinking about how to redesign these areas, but it's just to say, this is not a far off concept. We're having these dynamics happening now. Okay, so let's talk about precipitation and flooding and health, right? So it's really important to recognize that low-lying communities near floodplains are often environmental justice communities, and they oftentimes do not have the resources themselves to conduct the mitigation that is necessary to protect their own homes and families. And so a lot of times there's also in these areas co-location near industrial farms. So a lot of the runoff happening from these storms is going to be washing out high nutrient pollution sources, and also to think about how to potentially, protect those farms from having that runoff occur. Also in these areas are communities with septic systems. A lot of times septic systems are failing and a lot of people don't know it. Sometimes those septic systems are so expensive to install that they're not even installed themselves. So when you have these excess precipitation events and flooding events, you're basically washing out lots of untreated fecal pathogens into the environment, creating waterborne disease risks, but also potentially contaminating drinking water wells that unless you know to purge your well and flush it out after one of these contamination events, you can be exposed to, again, more fecal contamination, which can result in acute gastrointestinal illness. And this next slide is a really nice study that was done in North Carolina looking at this very problem. And I won't go into all the details of the study here, but it's just to say that they looked at the census tracts that had more than 33% flooding after two different hurricanes. It was Matthew and Florence. And they saw that there was an increase in emergency department visits for acute gastrointestinal illness. And if you land yourself in the emergency room after having diarrhea and vomiting, it really means it's a severe infection, right? There's far more infection, if we call it the iceberg effect, right? Or there's far more infections going on in the community if you have one person going to the emergency room. So really, it's an important outcome to pay attention to. Importantly, this study also found that American Indians and Black people had higher risk for these acute gastrointestinal illnesses after storms. And these are historically populations that have been pushed to these less desirable flood-prone areas. So important focus on equity here, that thinking through how to mitigate for these future scenarios. Special attention needs to be paid to more vulnerable populations that are in these flood areas. So let's talk about those flood areas. This is you can go to mdfloodmaps.net/map and find, like, you can drill down on these maps that I'm going to show you today. And so I'm just going to flash up a few of the ones that I think are important for this conversation. This is are effectively floodplains. And what you can see here is really distinct lines of the inland rivers, right? These are actually what the flood scenarios for those rivers. And, you know, when you have extreme precipitation, it's not just on the coast, right? You have all of these watersheds, just rivers cresting and creating flooding scenarios that potentially are in your backyard. So then I'm also now, you can see how those rivers went away because now we're in a sea level rise vulnerability scenario. And you know, some areas on the coast may not be as vulnerable as others, but you can see here that in the Maryland region, those blue areas are really going to be under water in the sea level scenarios that are in the near future. How to mitigate for those, how to move people out of those areas, how to transform that land into potentially something productive, and we'll get to that. So don't despair, right? We want to think through creatively what we can do to mitigate this. And then last is storm surge, right? So these hurricane scenarios coming through, it creates different dynamics when you combine big storm surges with precipitation. And you know, this is potentially more of the land area that you're seeing here is colored in these scenarios because they're rarer events, but they can probably do the most damage in these events. So knowing where those storm surge areas are is important. And so now, how is this going to impact our health? And before I get to that also, I wanted to flash back to the storm surge map, because though I'm saying they're rarer events, they are extremely important events when we're talking about all types of pollution, coal ash sites, right? Hazardous waste sites that are Superfund sites that are, you know, regulated under certain laws, but need to have special attention paid to them because those big storm surge events can spread these very hazardous material in much wider scenario, you know, across bigger swaths of land and really wreak havoc for generations to come if we're not planning for how to handle those specific sites under these scenarios. So I wanted to mention that before I get into more microbial, you know, acute gastrointestinal illness conversations here in this next piece of the presentation. So let's talk again about septic systems and untreated wastewater that are coming out of homes in America, right? So most of us that live in cities are connected to sewers. However, a quarter of United States residents lack access to sanitary sewers. And so if you're in that scenario, you're actually required to treat your wastewater through permitted on-site wastewater treatment systems, septic tanks, okay? They're expensive to install and maintain. And if they fill up, you have to have a truck come out, and it's not cheap to do those things. And so if you don't have the right geology, right, if you are, you know, if you're living in a community that's had many other, challenges, be it, you know, poverty and at many levels, there's really no option to treat your wastewater if you're in one of these scenarios where you either don't have a septic system or it's failing. And so in these scenarios, you're just basically discharging raw sewage onto the ground, through the ground, and sometimes it's even in a straight pipe. And just to represent that here on the top left, you're seeing a sewer connection that's going to a centralized treatment plant. On the bottom left, you're seeing these permitted septic systems that are on site, and they percolate down, and septic systems do a good job of treating these pathogens. But often, if you have a failing system, or if you don't have a system at all, you have a straight pipe that's going down into your community. And this seems like it's a rare occurrence in the United States, but I would actually say here, this is a lot more common than I think we realize, even in Maryland. The example I'm going to give here is from a community down in Alabama, where straight pipes are actually a really common occurrence, and they have that kind of Mississippi clay soils that make there's very little permeability, and so you basically have these raw sewage systems in your backyard in these communities in Alabama. Want to highlight a personal hero of mine, Catherine Coleman Flowers. She is a MacArthur Genius Fellow. She is an environmental activist. She has written a beautiful book called Waste. She calls it America's Dirty Secret, and has really brought these issues out into the light and also brought out the climate and environmental justice issues that are associated with the situations that many communities find themselves in due to really historic and systemic racist systems that have left these communities behind. So let's also talk for a moment about just drinking water infrastructure and how climate change can really exacerbate what is already going on. So we have our water systems in America are aging. There are often water main breaks going on. You'll see in the top right hand, this is a community in Flint that is kind of active on the issues that were going on there related to lead in their drinking water, but also old pipes that led to the largest Legionnaire's disease outbreak in history, and the neglect and disinvestment in environmental racism that goes on in communities of color. In the bottom, you'll see here is the Pearl River, which is right near Jackson, Mississippi, which is cresting in this picture, and actually was the straw that broke the camel's back. Jackson's already failing water system. It took the whole, all the pumps in the treatment plant out, and city of Jackson, 185,000 people did not have any water for a very extended period of time. And if we can talk about that later, but that tragedy is still ongoing, and to me hasn't gotten the media attention that is needed. So let's talk about climate change and recreational waters. Okay, so hotter, longer summers, that is also where we're headed with climate change. It just means more trips to the beach. So packing up your car, driving out to Sandy Point Park Beach, which is a beach you see here. And it also means more gastrointestinal illness, upper respiratory kind of ear, nose, throat, ear infections and wound infections when we are kind of conflating these things of more people going to the beach, more fecal contamination in the waters, and more exposures that are going to, the data are already showing, increase these infections. And particularly vulnerable are children, the elderly, and weakened immune systems. So it's important to understand that after heavy rainfalls, you actually should be avoiding the beach. We call this dynamic the first flush. And so if you haven't had rain for a long time, you have a big rain event, it basically just flushes everything out into your recreational waters, and you should avoid the beach, even if they're, in my opinion, 24 hours for sure after that type of an event. But there are also advisories and swimming advisories that you can, that if they're on, certainly don't go there. But in those scenarios, I would, even if you have an open wound, I would be making sure to avoid direct contact with your cut in recreational waters, especially if you're swimming a few days after heavy rainfall. Sorry, just a public service announcement as a public health person. Last, and I'm going through this fast because I think the conversations that we're going to have on a lot of these topics is important, but I want to leave us with a more solutions focused ending and talk about how nature-based solutions are going to be a big part of this. And one thing we haven't discussed here is saltwater intrusion. And so with sea level rise, with coastal flooding, a lot of saltwater intrusion is going to be occurring. That's why you have Hampton Roads injecting treated wastewater into its subsiding areas so that you can avoid and push back that saltwater intrusion. It's just inevitably going to come. And so how to think through what the solutions need to be. So here we have the University of Maryland's actually School of Architecture, Planning and Preservation putting forward some ideas. And so here is a scenario of sea level rise with coastal agriculture. And what, this is going to occur with increased precipitation. And what you're going to have is basically this marsh migration and salt inundation. And so we need to think through how we shift our agriculture, right? And so productive, food sources are hugely linked to our health, and, good nutritious food is essential to fight off infections, right? So keeping our populations healthy even through their diets. Well, We need to shift agriculture upland and plant salt to more plant salt tolerant species. And then also areas that were productive in agriculture, we need to move and create marsh habitat. And so what does that mean for our food supply? Well, it is lunchtime, so I'm maybe going to talk something, maybe I'm going to say something more uplifting at lunchtime today. Well, here's one idea. Okay, so what are sea beans? I was actually introduced to them at my farmers market in Washington, D.C. last year. And these sea beans can be grown anywhere in marshlands. What are they? They're called samphire. They're succulent marsh dwellers and one of the most salt tolerant terrestrial plants in existence. They're in the beet and spinach family, and they have a very high nutritional value. And I can attest, they taste great. And they're this kind of plant-based salt alternative. So what are those nutritional benefits? Well, they're a great source of omega-3s, great source of magnesium. They have protein in them, vitamin A, lots of fiber, more iron than kale or bananas. Have I convinced you yet? More calcium than asparagus. And they have all these kind of sea minerals that, provide just unique and important minerals for us. So let's think through what saltwater agriculture is going to look like, especially in an area where we have so much coastal land, and sea beans could be one of these products that are developed without the need for naturally occurring fresh water. So if they didn't look appetizing to you there, here's a picture of them looking more appetizing to you. These pictures are from this farm down in South Carolina called Heron Farms, and they actually have a really nice informative website for you. But I wasn't able to find any in the Maryland region. So if you know of any, please let us know in the chat. And here is the picture of where they're grown on Heron Farm. So I think reimagining what our coastal infrastructure agriculture is going to look like. So let's also just end on climate solutions and adaptations. So I talked about the need to repair and incentivize repairs and upgrades of septic systems, and potentially incentivize installation of these septic systems, right? Thinking through, how do we keep all of this unwanted, untreated waste water out of the environment, especially to ensure the health of our recreational water, not just for recreation, right? But there's lots of nutrient loading that can kill off fish species and essential ecology that we need to maintain the food sources of the Potomac watershed. Urban stormwater management. So thinking through how we can slow down water, all those rivers that you saw on that map that are going to be flooded with lots of precipitation. How do we slow that water down, keep it upstream, and so that the hydrologic curve, right? We have these huge kind of peaks in our hydrologic curves. How do we shave down that peak and retain the water? So thinking through new ideas through cisterns, through rainwater, retention ponds, and creating educational signage in our communities and in our environments. And often local communities know where the water is building up. And once you can engage the local community in these conversations, you begin to have more solutions that are thought up because the community knows where that infrastructure is needed most. So also green roof systems, again, water retention. We don't want that water to go rushing through our stormwater drains. It just makes that first flush even more intense. And rain gardens and street trees, and really thinking through how to incorporate not just storage for water, but also uses for water and street trees create shade that can produce have cooling effects in our urban heat islands. And so, right, planting a tree is one of the most hopeful things we can do for our future. Permeable pavers, right? We need to take away all this concrete and really think through, how do we make these the areas that have been absorbing our water for centuries. We need to bring those absorbers back. And so creating permeable pavers that can have the water soak into the ground. And also importantly is identifying these hazardous waste sites in our floodplains, in our coastal flooding areas, and identify them, but also remediate them so that when those big storm surge events occur, we're not spreading those pollutants all around and doing damage for decades to come. And so, believe it or not, there's way many of those sites around that than I think I personally know about. So I'm going to stop there, stop sharing my slides, and just leave my email up there if I, for any other questions that come up. But I'm happy to answer questions. I kind of zipped through the presentation there, and so I can flip back to other slides too if that's helpful. But yeah, let's talk about climate change and our health.
Fantastic. Thank you so much for that presentation. It generated a lot of questions, and so I'm glad we left plenty of time in the agenda to get to them. But before we jump to questions, I'm really excited to, as part of this webinar today, launch a resource for all of you, which is a fact sheet on climate change, water, and health. So I'm going to put that in the chat right now. And you can check it out. This is several of the organizations involved in Maryland Health Professionals for a Healthy Climate work to put this together. And you'll see those groups at the bottom of the fact sheet. But check out that fact sheet, use it, send people the link, print it out, bring it to events. And you can check out it's hosted on another website, and I'll put that in the chat as well. Or you can learn more and see, this is the second in our series of webinars and fact sheets in this realm of education and action. And the first fact sheet that we had was much more broad about general climate change and our health. And this sort of water specific topic was actually born out of that. So I would also suggest to all of you, if you have a need in terms of wanting more information on climate change, your health, and insert topic here, please let us know and we'll work to get that for you. So yeah, and so with that, so check out the resource. Excited to launch it today. You all are the first to have the link. So make sure you check out that link that I just put in the chat and use that resource to help, like we mentioned, wanting to have these conversations with your colleagues, your friends, your family. Because the thing we know about climate change is that people are actually really concerned about it, but they don't often talk about it on like regular conversations. And so they think they're alone in that concern. And so when we talk to others about this topic and we talk about the ways that climate change is impacting our health, we actually spur action. So with that, I'm going to hand it over to one of the partners who was really engaged in producing this fact sheet, the Alliance of Nurses for Healthy Environments, and pass it over to Christina to say hello and moderate the Q&A with all of you.
All right, thanks, Rebecca. Hi, everyone. I'm Christina Watkins, a nurse practitioner and a student actually at Johns Hopkins in the School of Nursing and the School of Public Health. And thanks for letting me join you all today. So Dr. Exum, great talk. Thank you so much for that. And we've got some great questions. So first is from Christine, who's asking, can you speak to geoengineering and if it has had an impact in affecting climate change?
Oof. So you mean like, so that question I'm assuming is more like seawalls, right? And kind of big, yeah. So, I think we need all of it, right? And so there are certain cities that are absolutely going to need to, if you want to preserve your, lower Manhattan, you need to really raise the wall, right? Around the bottom of the island there. But that needs to be paired with, I think, also these, kind of more nature-based solutions, right? I think we underestimate how much these kind of barrier islands and marsh areas are able to absorb a lot of these storm surges. And I think that we want to kind of like engineer ourselves out of these problems. And believe me, I have learned a lot from the Dutch, right? Like they are the example of how do you live lower than the water. But it's almost exceeding also, I think, their, our climate change realities now, I think are exceeding their engineering, capabilities. But I think we need to be doing both. And with emphasis on, I think my personal take on is that we've underestimated the ability of nature to really help us out here.
All right, great. That's a great question. And it kind of plays into, we were talking about the rain gardens and, making cities more sponges. So I think that has to be a multi-pronged approach for sure. The next question is from Nancy. Are there resources you would recommend to find straight pipes in the Chesapeake Bay watershed?
Thank you for this question because, taking from Catherine Flowers, Coleman, this is America's dirty secret, and people are in the shadows. And because of the requirement that you have to have this infrastructure if you're not connected to a sewer, it means that no one is going to advertise or tell anyone if they have a straight pipe. And so many communities, actually down in Alabama, where there's been a lot of community organization around this, one of the community organizers actually was just sharing with me last week that she's even from the community, and it's very hard for people to come and talk to her about this. And so if there ever was so the short answer to your question is no. My gut reaction is that there is no publicly available site or website that this is going to be on. But that said, if there ever was a need for like local community engaged activism, it is on this topic, like people who trust each other, people who, have just like long ties to and neighbors, right? And so because of the legal implications for what happens if you don't have these on-site water, wastewater treatment systems. So but I can also tell you that there are a lot of communities in and around, right, those maps that I was showing you that are off not on sewer systems, right? And and they're already overburdened, right? And so it's so expensive to install these systems that they're probably in so many locations. You can do source tracking you can do water sampling and monitoring and source tracking to see if it's coming from an animal or a human source, but that won't really pinpoint you exactly to where these locations are. So this is like a boots on the ground, trusted community by community effort.
And I just wanted to add one thing to that, Natalie, because it's a partnership that we're doing right now between Potomac Riverkeeper Network and professors at Johns Hopkins School of Public Health is some source tracking, as she mentioned, to identify in the upper Potomac watershed of where we're seeing high bacteria levels with a not known discharge point. So we're going to track and figure out the type of species, human, poultry, et cetera, that the bacteria is coming from. But again, that's not going to tell us it's this spot. It's just going to help us narrow down the sources.
It's a first step, right?
All right, great. That was a great discussion. So next, Renee wanted to talk about, in addition to everything that you've mentioned, can you talk about contaminant concentration levels of rising during drought conditions, such as PFAS in the water?
Yeah, so PFAS are really in the news, right? These perfluorinated substances. So the carbon fluorine bond is the strongest bond. They're extremely persistent in the environment. They bioaccumulate. And we have basically given the chemical industry a free pass for the past 40 years to produce them and release them. And now we're just catching up with what the health impacts are of them. And there are many. That said, drought conditions, right? So I talked all about like the too much water scenarios. I didn't talk a lot about the not, what happens in these drought scenarios. But yeah, so I'm pausing to say there are a lot. So the question really also is, are PFAS going to be more of a problem, say if we're in a drought scenario? So I'm envisioning different situations there, right? So there are let's just take the Baltimore City County watershed, for example. We have amazing watershed protection in our reservoir systems where our drinking water supplies are taken from. Thankfully, there's such good watershed protection that companies really haven't been able to go dumping these perfluorinated substances in and around the reservoir systems. And so when we have measured the PFAS that we've measured in the drinking water in around Baltimore is actually pretty low. Now, if we have a drought situation, that means that the reservoirs are so low we can't draw from them anymore, and we have to switch over to the Susquehanna River, where there is a lot of industrial pollution, where there are a lot of bacteria, where there is a lot of turbidity. And it is very hard right now. Our drinking water treatment plants are not equipped to take PFAS out of those sources. So I'm just using one chemical example. There are other contaminants that can get into our drinking water when we have drought scenarios. But it's to say, when you have a source switch, it brings a world of problems. And as much as I, as a scientist, want to believe that drinking water treatment is a science, not an art, there's a lot of art to it. And when your turbidity levels change, when your pH levels change, it just makes treating the water so much more challenging. In addition, there may be more PFAS chemicals actually in the Susquehanna River itself. So yeah, I think the drought scenarios are going to be very source specific. And so if you're on a private well, what does that mean when your water table level drops and you may be having, more, kind of naturally occurring metal contaminants? It's like, I can't answer it in one big blanket answer. Hopefully that gave you a little bit of an idea.
Well, and this also gets at the interplay of how air quality and water quality, are both affected by climate change. When there's a drought scenario, there's also a lot more dust, dirt, in the air, which impacts respiratory issues and other health impacts because of impaired air quality. So as if we're in a drought scenario, it doesn't only affect water supply, it also actually impacts air quality, which is another just sort of interesting, because I think we often hear a lot about the air quality impacts of climate change. And so it's kind of why we wanted to focus on water today, but it's the interplay, right? It's also sort of an example of how you can't always distinguish or neatly put into a box one solution or another, but that's like you said earlier, sort of an all of the above approach, because it's that drought scenario that actually also, which is a water driven impact of climate change, but it also impacts air quality. So just sort of, again, trying to demonstrate ways you can talk to others about this in a way that they understand, because they're like, oh yeah, there's nothing more meaningful really than having this one-on-one conversation with folks and seeing the light bulb kind of go on. Like, I get it now. I want to be involved, and how. So yeah. So just like because I work a lot on air quality, sort of connecting the dots there too.
It's a great point.
Absolutely. I just wanted to backtrack a little bit. I just saw Patrice's question. This is going back to septic a little bit. Do you know if composting toilets are a viable option where geology or other circumstances won't allow a septic system? And just a little plug, I live on a sailboat and we have 2 composting heads. So this is very dear to my heart.
Thank you for this question. We're so used to putting our poop in perfectly drinkable water and flushing it with large amounts of that perfectly drinkable water down in a pipe that we never see again, that like breaking that idea for Americans in particular is like crazy, right? So thank you, Christina, for doing that for us already. But these areas are like, I think, especially for people who live on the coast, there are just areas that will be underground, but people still want to live there. And so actually, there are organizations who are thinking through, how do you create homes that you can just lift up and move when those scenarios occur, right? And that means having utilities that aren't wed to pipes that are under the ground. And composting toilets, especially urine diversion toilets, because the urine makes the feces, so we call urine liquid gold. Feces can actually be used, if the pathogens are inactivated correctly, can be extremely fertile for, you know, replenishing the soil and such. You know, as a public health person, the feces need to be handled properly. And so, you know, having a composting toilet means more responsibility. But I do think this is a reality of how we're going to live in these coastal regions that need to be talked about, and practiced and piloted and promoted. And I thank you for bringing that up, because they actually can be safe. And then we aren't flushing away all these valuable sources of, and you can turn them into something that is productive.
Well, that was a fun one. Next, Catherine, first wanted to give kudos for the excellent presentation. And can you discuss how climate change, sea rise, and wastewater impacts those living on the Potomac in the Northern Virginia residential areas or Old Town? What can individuals themselves do?
Right. And this is where I just get like gloom and doom. You know, I think there are more hard engineering solutions when you are trying to preserve historic areas, right? I don't, you know, if I worked for an engineering firm, I'd like probably have way more of an idea about exactly what those were. But you know, it's like Venice, right? Like, you know, you see all those, you know, it's just like, there's gonna be cities that have streets that are just regularly flooded, and you kind of adapt to living that way. I honestly think that the harder ones and the people who are going to suffer more are the ones who are living in more rural coastal regions that don't have the resources to be able to pick up and move somewhere else. And like that to me is where my heart really goes out in these situations, and how can there be government incentivized programs to really help those individuals make new lives for themselves in other locations.
I think it's also important to also mention, you know, individuals, what we can do in terms of adaptation, and then also mitigation. You know, mitigating, working towards the elimination of our reliance on fossil fuels helps prevent more climate change. We're already locked into a certain amount, right? But like preventing more bad things, we can do in terms of mitigation measures that then, and what we've talked about a lot today is, you know, adaptation. And what we can do, you know, health departments can think about early warning systems for flooding, and making sure, again, education about what to look at, and don't, you know, again, very real, tangible advice. If there's a heavy downpour, watch out, and you have an open wound, perhaps don't go to the recreational water and swim around the next day or the day after, or the day after. So, you know, those really practical pieces of advice I think are important. And then working towards mitigation, elimination of fossil fuels. And then I know I work in a different perspective than working at an academic institution. So I'm just going to say also, the biggest thing we can all do on climate change is vote. So that, you know, systemic change where we live happens at a policy level. And so, you know, it was a big primary election day yesterday, and there's a big election coming up in November. And so if you want to make a difference on climate change, do those things every single day in your life. That helps work us towards mitigation, and you're adapting safely in your own life. And please vote, because having climate champions in elected office will make a huge difference in how we're able to address this as a nation. So and as a state and localities. So vote.
Definitely. Always step one. And I also wanted to just highlight what Judith had mentioned in the chat here, you know, about something individuals can do, you know, talking about rain gardens in your home, or replacing lawns with dense plantings of native shrubs, grasses, wildflowers, all, you know, steps that an individual homeowner can take also to help create more sponginess in our landscape, which would be great. And let's see. Evan had a question about do you know of any studies that examine the transport or fate of toxins and carcinogens in urban runoff and human exposure along the pathway?
Yeah, thanks for that question. Off the top of I do not have the link to send you exactly right now off the top of my head, but I can do I can do that afterward if that's helpful. And I can put my email in the chat too, again, if that's helpful to find that for you. But so my immediate reaction is that, especially in urban runoff situations, you're not going to have, because of our piped drinking water systems, you're not going to have like a direct causal effect, right? You know, the solution to pollution is dilution. And so that urban runoff gets sent through down into our precious, Potomac watershed. And it does, and so one of the important aspects to preventing that from occurring is also, removing our combined sewers. And that's, been in policies that have been in place for a long time, and that's continuing. Exactly, like what are those exposures? I think I can't say immediately, but you think about even just like runoff from the street, and you have like cars that are leaking onto the concrete, and that washes out. It's going into ultimately like our oceans. But it gets diluted, and then how do you really measure the health impacts of that? That's like a very hard question, especially in the environmental health field, to really show, okay, these people were getting sick from this exposure to all of this runoff from these cars, right? So we don't have that evidence. And kind of just chalk it up to the solution to pollution is dilution.
I love the rhyming there.
Try it, or if you're on mute, try saying it a few times.
Ollie made a good point when we were talking about liquid gold and whatnot from composting, that research and studies have shown that the sludge from products of sewage treatment cannot be used in agriculture because of the heavy metals that concentrate in there.
Thank you for that point. That is because at our wastewater treatment plant level, it mixes up a lot of different wastewater. But in this decentralized system of a composting toilet, you're not mixing any of that poop in with the industrial waste or the other kind of PFAS laden substances, like it's you and your family's poo, and ultimately, like, you and your family's poo isn't even that pathogenic to you because it's your own poo. So that is a great point, and actually one really to just note here that we are only beginning to open our eyes to the what the application of biosolids on our farms and our fields has done to the uptake of these chemicals, even in our food, right? And so we are just beginning to understand that. And I agree with you that we should follow the lead that the state of Maine has taken, which is to, at this point, kind of ban all of it until we have figured out which sources are safe to apply and which are not, because a lot of damage has been done already by the application of these biosolids. Thank you for that point. PFAS are, I just wanted to, I agree. I do not like acronyms. They are perfluoroalkyl substances. They are, so the chemical industry has invented these, we call them forever chemicals because they do not break down in the environment at all, and they persist. And they are these long chain substances that have been used for many useful ways of, stain-proof couches and, waterproof jackets and Teflon pans, and they've been used in so many different substances for generations now, that they've basically been dumped in so many different places in the environment that they are, if I looked in, they're 98% of Americans' blood. So some have very low, we basically all have some level of it. Most of us have very, very low levels now. But if I were to have measured the population's blood, in late 1990s, it would have been, tenfold higher than what it is today, because we have been slowly phasing these chemicals out as we've realized how harmful their health effects could be. So they're carcinogens, they're having reproductive effects, they're potentially having effects on obesity, and it's really heartbreaking when you go down the list.
Yeah, stroke, heart attacks, all of it. It's all affected by these. It's really sad. On the disease front, Catherine had a question about zoonotic diseases. I'm sure now that COVID, we're all post-pandemic and thinking about these things a little bit more. Can you talk a little bit about zoonotic diseases related to mosquitoes and the weather environments that we are living in?
Yeah, great point, right? So the idea that we could be having dengue in this region, I think is one we all, as especially as health professionals, need to begin thinking about. What are those mosquito-borne diseases that are totally, not on the radar if somebody were to come in with these non-specific dengue-like symptoms? But especially as we're talking about precipitation and heat and water pooling up in different areas, absolutely, the state of Texas is probably on the frontier of this. I'd say Texas and Florida. And basically what they do is they monitor mosquito pools. So they'll go out and they will sample from pools. They do it mostly for West Nile because there's a lot of West Nile down there. Dengue is also in the Houston area as well, but that, I would say, even thinking through what are those programs, those mosquito monitoring programs that we need to build up and put in place so that we are prepared when we start seeing these increase in human cases, which we're thankfully not seeing yet, but I think we do need to have those preparations in place. And also think through, are we going to do what they do down in Dallas County, which is basically when you find a pool or when you find people with they just spray everything everywhere, and thinking through what does that mean for the health of the communities at large, and are there any other ways to begin to counterbalance, right, these increase in vector-borne diseases.
Right. And if in your backyard, I feel like a lot of people have like buckets or planters or things like
Yeah.
that's where standing water, ends up being a habitat for mosquitoes and eggs. So check your backyard, especially before is better, but after a rainstorm, turn that bucket over. Don't let, try to avoid standing pools of water at your, we talk about what people can do, and that's a big thing you can do. Try to avoid standing pools of water in your own yard, on your deck, like whatever outdoor element is near you. Try to avoid standing water.
Yeah. Well, it's a great answer for a complex, interrelated situation. And I think that's really water and climate change and health in a nutshell. Is really just, there's so many interconnections that it's, you can't just talk about one thing. But it looks like we are almost out of time. So Rebecca, I'm gonna let you wrap it up here. Thank you.
Thanks so much, Christina. Dr. Exum, thanks so much for being here today. Wonderful presentation. Huge shout out to everybody who's involved already in Health Professionals for a Healthy Climate here in Maryland, and to the Potomac Riverkeeper Network for co-hosting this with us and sort of being initiating this conversation. And so I put the fact sheet in the chat again, so make sure you check that out. Thanks to the Alliance of Nurses for Healthy Environments for really being a driver behind the fact sheet, and Christina for all the work you did on that fact sheet and putting it together. And so on behalf of the Maryland Public Health Association and Maryland LCV, who co-convene this health table, the Maryland Health Professionals for a Healthy Climate, thank you so much for joining us today, and for all the action and conversation that I know that this will continue. So we'll send around the link to the recording and more information. So thanks again. Use that fact sheet. Let us know how you're using it, and if we can be of help on more information on how climate change is impacting your health and what you can do about it. So thank you so much. Hope to talk to all of you soon.
Bye.
Thank you.